screen if that is okay. Okay, so can you all see my screen?
Yes.
Okay, great. So this, I think I started this last year, but it wasn't very formal at that time. Or I think 2 years ago, at that time, the COVID was not developing, so I was able to organize something for the African students to meet in my house for a small get together, and then we were also able to discuss a few issues. But as we are all aware, it's a pandemic, so a lot of the things will have to be done virtually. So my name is Banda Abdallah. I'm an MD. I also had my MPH MBA from Johns Hopkins. So this is going to be the outline of what we talk about. I don't want to spend much time, giving lectures. I would rather we zoom right into Q&A so that all the questions you have, will have time to answer them. But for the purpose of structure, I'd like to talk briefly about my profile and my experience during my program at Hopkins, the concentrations and the certificates that you would be choosing, grading and creditors, how you have to plan your program, the importance of networking, collaborations, and then the final session will be the Q&A. So before I proceed, I just want to take a moment and congratulate all of you for getting accepted into Hopkins. I know most of you probably had difficulty making your decision because you had other offers, but I would have to say that this is the best decision you make in terms of getting an MPH degree in the US. So congratulations on your achievements. So briefly, so I'm a medical doctor by training. I have my education in the University of Ghana School of Medicine and Dentistry, where I have my Bachelor of Science and Bachelor of Medicine and Bachelor of Surgery. I then went ahead and practiced for 2 years in a regional hospital. Following that, I joined the Ghana Armed Forces Medical Corps. And then immediately after I commissioned into the Ghana Air Force Medical Corps, I joined the UN peacekeeping mission for Level 1 Hospital as the leader of the Level 1 Hospital in Cote d'Ivoire and Mali. This was a little over 2 years. It was during that time that I decided to pursue public health because I thought that most of the experiences I had, I would have been able to manage them better if I had the knowledge in public health and also in management. So luckily I got accepted into the MPH MBA Summer Scholars Program. Around the same time, I was also a center scholar at the Center for Drug Safety and Effectiveness. Even though I did MPH MBA, I focused mainly on epidemiology and biostatistics because I knew what I wanted to get from the program. I also had a certificate in pharmacoepidemiology and drug safety. And doing all this, I was working 2 research assistant positions, one with my academic advisor, who is in the Department of Epidemiology, and one at the Department of Health Policy and Management. I did my internship with Japago in Southern Africa, and during that same internship, I used that same internship for my practicum requirements. My capstone was on data analysis. So after spending 2 years with the MPH MBA, I did my optional practical training with the Baltimore City Health Department as the manager for their COVID-19 response from 2020 to 2021. And I just been accepted into the PhD program at Hopkins. I'm in the epidemiology department. So hopefully I'll be starting that very soon. So let's move ahead. The most important thing. So, you've started your program. Summer term is relatively, more structured. Everything is given to you. So it's easy. The programs, the courses that you have to register were already, populated in your course class. So it was easy for you to move along. But from first term to fourth term, you would have to make your own choices as to the courses that you need to select. And the most important thing for you to determine at this stage is whether you would want to concentrate or you want to customize, right? There's, there are pros and cons for doing both, but you would have to assess whether there is a particular field that you want to really gain expertise on. And, some of the factors that you have to consider in either concentrating or customizing will depend on your interest, right? So what do you really want to achieve, or what skill sets do you want to get? Is it that you want to know a little bit about data analysis, or how to perform research, or how to do research on your own, right? So these are the issues that you have to look at. And on the right, you can see the numerous concentrations available, right? So you would have to really think through in order to select which particular one you want to do. And the job opportunities, it's oftentimes the most critical, especially for international students, because I know for students coming from Europe and elsewhere, most of the time they are not thinking of their optional practicum training period. But for international students, we want to finish the program, at least do a 1 year optional practical training. And your concentration sometimes will determine which, the job opportunities that you have. Typically for international students, epi biostats seem to be, the easier route to getting an offer after graduation. So you would have to take into consideration all this. And then another aspect to look at is opportunities for mentorship, right? I know in certain concentrations, the faculty are not that supportive as compared to others. I knew of, one of my mates, she wanted to do health policy and management. But after she got to know the faculty, she realized that they were not giving her the support that she needed, so she had to switch. And the good thing is that you can always switch as long as you meet the criteria for the other department. So you have to look at, the supportive environment in that particular concentration or department in order for you to make that decision. And then your future intent, right? What do you want to do in the future? Do you want to be in research? Do you want to go on and get your doctoral degree? Is it TIPH that you want, or PhD? Or, you just need the MPH just, to add to your record or to add to your certificates, and then go back and do the things that you used to do, right? So these are all the, some of the factors that you have to look at. Your future intent is very, very important. And then the certificates. Usually we say that when you're at Hopkins and you see the certificate, it's like a child in a candy shop, right? So you are tempted to select multiple certificates. But it is often not practical, because by the time you select all your core courses, all your electives, you realize that it becomes extremely challenging to even complete one certificate. So you have to choose a certificate that you think you cannot get anywhere else, because these days there are a lot of platforms. Coursera offers a lot of options for certificates in most of these courses. So you have to choose a certificate that you think you can only get it in Hopkins, right? So that would help you make that choice. And as usual, the interest that you have in that particular certificate, you shouldn't do something because everybody else is doing it. You have to assess yourself, look at your future plans in order for you to choose a certificate. Job prospect too is the same thing. Usually, especially if you have a clinical background or you have a health background, sometimes it's more advantageous if you have something on clinical trials. I mean, that is what I've seen. Most of my colleagues who were working in a hospital setting as a postdoctoral researchers, some of them, the certificate that they chose were in clinical trials or maybe pharmacoepidemiology. So you have to look at all this. And then you also have to look at your credit hour requirements. I know that there've been slight changes in your curriculum. It looks like there's more core courses than we used to do. So you have to look at all these in order for you to select a certificate, because some certificates will require you to meet at least 18 credits in order for you to be awarded that particular certificate. And you also have to look at the degree of overlap with a certain concentration. It's very important. So for example, if you're doing epi-biostats as your concentration, you would know that there are some certificates that the course requirements for that certificate may overlap with the concentration that you're doing. So for example, the certificate may require that you do epi 751 or epi 752, right? And your concentration also requires that you do that. So you can do just that course and then use it, to meet both requirements in your concentration and in your certificates. And then it's also very important for you to realize that a certificate, it's not just a paper. It's not because you want to kill some time. It is very crucial that you get a skill that you cannot get easily anywhere, right? So I usually tell people that, soft skills, even though soft skills are very hard to learn, but it's usually learned on the job, right? So, as much as, certificates like leadership, maternal health, global health, and all that may sound a bit fancy, it doesn't really give you a unique skill set that you can boast of, because anybody these days can go online, Google, for, maternal and child health materials, or Google leadership materials and read, right? You can get those in Coursera, but there are some courses that you can hardly get on the web. So those are the kind of skills that if you want to do certificates, you should consider. Now, the next item is grading, right? So sometimes I think the time that we started the program, we didn't have the insight as to how the grading is done, or the factors that might affect our GPA, right? Because if your intent is to proceed and do a doctoral degree, then your grade is very important. Your GPA is very important. So you would want to safeguard your GPA, right? So, you can, in the pandemic, I realized that there are several courses you can take pass-fail instead of a letter grade. So you would have to decide which particular course you want to take it as a letter grade and which one you want to just take it as pass-fail, or which one you can audit. So the difference between a pass-fail, letter grade and audit is that for a letter grade, obviously, at the end of the course, you get either A or B or C posted on your transcript. But for pass-fail, it's either P or F, right? And for you to pass, you need a minimum of, I think, 70. So a grade C and up is pass. right? And if you audit a course, what it means is that you get access to the course on Course Plus, but you are not expected to submit any assignments. You are not expected to attend any classes. You're not expected to write any exam, and you don't get credit for that particular course, but you have access to all the course materials. So what factors will determine whether you have to choose a particular course as a letter grade or pass fail? It will depend on the course requirement or the concentration requirement. So for example, if you're doing, say, maternal and child health, or if you're doing infectious diseases, or you're doing epidemiology and biostatistics, there are specific courses you can't, it's not advisable for you to take them pass fail. You're better off doing it for letter grade. But if you're customizing, it means that you have a leeway. You can, select as many courses as you want as pass fail. And pass fail courses does not affect your grade point, or it doesn't affect your GPA, right? So, in our class, some people were strategically picking courses to make them letter grade. So if they see that they are doing very well in that particular class, they continue with the letter grade. If they see that that particular course is going to mess up their GPA, then they switch to pass fail. So, but that, as I said, will depend on the concentration requirement, right? And also your interest in the course. If you're very interested in the course and you want your employer to know that you did very well in this course, then you would have to choose a letter grade. There are some, normally most employers will not require your transcript, but a few of them may require a transcript, a few of them, especially if the work you're going to do demands a certain skill set. So they would want to know how you fared in that particular course. So you also have to look at how the course fit into your future plans. If the courses you're doing, you don't really see it benefiting you in the future, or you don't really see you using it in the future, then there is no point picking a letter grade. But if you think it's going to impact how your future looks, then you have to consider choosing a letter grade. And then overall, your strength in that particular course. So if you think that this course, I really like it, I'm doing very well, then you should take it as a letter grade. And then if you're also concerned about your GPA, as I said, if you are looking at other programs after MPH, if you're looking at a doctoral degree after your MPH, then you should be concerned about your GPA. So you should determine whether you pick a letter grade or pass fail for a particular course. And then the total time dedicated to the course, right? So if you think you would have ample time for the course, then you can take a letter grade. If you think that you are overloaded, so that particular course is not really necessary to take it the letter grade, then you can take it as pass fail. And then factors that also affect your credits. So usually we advise that people advise that you don't go beyond 18 credits per term, but I've done 22 credits per term before, but it wasn't easy. So you would have to assess your capacity to take more than 18 credits, because sometimes it can become very, very challenging. So 18 is the average, but you can go above 18 if you want, but usually I wouldn't advise that. But if you can, and you think that the certificate you're taking will require that you take additional credits, then you can go ahead and take maybe 20 at most, right? So, your course requirement will also determine on your visa requirement, like the visa requirement for that particular program. So for international students, we are required to do at least one course on site for every term in order for you to be in good standing. And also your time dedicated to networking. So if you're taking 20 credits, 22 credits, you have little time for networking. And networking is very important. Some people too like to do research assistant positions. So if you're taking research assistant positions, you can't do more than 18 because you would either sacrifice your job or sacrifice your degree, your grade. So I wanted to show you how the grading is done. So as you can see, there are some courses that specifically set a cutoff for their grading system. So A is 90 to 100. So above 90 is A. Above 80 to 89 is B, and 70 to 79 is C. But there are other courses, for example, biostatistics, that usually draw a curve. So based on the performance of the class, they determine which percentile would get A and then which will get B and C in that order. So at times for biostatistics, if you have probably 87 and above, you are likely to get an A, depending on the performance of the entire class. So as I said, for credit requirements, if you're customizing, you're expected to do about 40 to 45 core credits, and then you can choose about 40 credits that are electives. But if you're concentrating, you will still have to do the 40 to 45 credits, and then your concentration would require that you do at least 20 credits. Some concentrations, you end up doing at least 28 or 30 credits. And then you will have the opportunity to select about 15 to 18 credits on your own. So course planning is extremely important, right? So we didn't realize this early. I realized this when I was in my second year of the MPH MBA program. So if you can, try and plan out your course or yes, your program for the entire year, right? It helps take away the anxiety during registration week. You know exactly the courses that you're registering for. It also helps you. It keeps you in focus, right? Because you've decided the courses that you want to do. And you can use a simple Excel sheet to lay out all your courses. So there's an example that I want to show you. So this is like a simple Excel sheet, right? That the academic year, you have your name here. You have the summertime, fall 1, fall 2, spring 1, spring 2. So it's first term, second term, third term, and fourth term. So it's advisable that if you have time, sit and look through the course, the program manual, look at all the courses that you want to do. What you would like to do is to fill out the core requirements first. So you fill out the core requirements for all the program. So you can see the blue that I've shaded here are the core requirements. So these are all core requirements for 2021, 2022, right? And then the green ones are the concentration requirements. So this particular person is interested in doing epi-biostat. So these green ones are the concentration requirements. And then the orange ones are the elective courses that you can choose, right? And then there's also like a program-wide requirement, like a capstone, which is in yellow. So you can have something simple like this, and then at the bottom of it to show you the total credits that you're taking. I think the minimum credit that you have to take in order to graduate is, I think, 80 or so. So, once you've been able to lay out your course plan like this, it becomes easy. It becomes easy for you to, register from one term to the other. So as we are talking about academics, it's also very important to do networking, because that is one of the main reasons why you are coming to Hopkins. Hopkins is such a diverse environment. You meet a lot of people from different backgrounds, from different countries doing amazing things. So spend some time and get to know people, right? Get to know your own cohorts, because you never know who who will be the next global health leader. There was a lady in my class who was also a summer scholar in my class. Currently, he is the head of infectious disease um, ministry in Brazil, right? So you never know the people that you are in class with. Get to know them from day one. And then also important for you to know students from other programs or other degrees. You are doing MPH, somebody is doing MBA, somebody is doing maybe engineering, somebody is doing medicine. Get to know all these people if you have the opportunity, because it's very important. And the next important thing is faculty, right? The faculty in Hopkins is very, very welcoming. And I know from where I'm coming from in Africa, you can just walk to, your professors and demand something. You can just, send emails and request for something. But in Hopkins, they are always ready to help. They are always eager to help. So there's the time that you have to, assess your interest, reach out to faculty members that share the same interest with you, and rest assured those people will respond to all your emails. And then another important thing is alumni networking. So as you're in the program, try and reach out to people who have finished the program, find out what they are doing, so that you would also be able to plan your career. I realize most of us have LinkedIn. It's a very good social platform to start your networking. Make sure you have updated your LinkedIn profile, get a good picture. Dr. Anude will say, get a picture that you are smiling in it, right? Because nobody wants to, network with somebody who is always frowning. So LinkedIn is very important. And then another important tool is Handshake. So Handshake, it's a platform for, I think, all students and alumni, right? Where job opportunities are shared. You build your profile, job opportunities are shared, and you can apply for jobs through Handshake. It's also important for you to create a profile in some of these organizations, World Bank, UN, and the rest. Get some time, create a profile, get job alerts if that's what your interest is, and then you can make use of your time at Hopkins. It's also very important to attend networking events. If a department is hosting a particular program or a particular presentation, find time and pass by. You may never know. There are a couple of people who got their job through events like this. You go to an event, you meet somebody, you share your card with the person, and then you keep in touch with them. By the time you're graduating, they'll let you know if there's any vacancy in their department. And one other thing is for you to get a complimentary card. It's very important. At this stage, you need a complimentary card. And then if you have time, you can join consulting clubs. For those of you who are interested, I think there's a consulting club at the Carey Business School. You can reach out to the president, show your interest, and then you can take it from there. So these are all great ways of networking. Please make use of it, because the 1 year is not that long, and the program is actually 11 months. If you focus only on your academics, by the time you realize you're graduating and you don't know anybody, right? So you wasted the whole 11 months. Other things I would also want to highlight, though it's not academic, and once you are in the US as international students, one of the key things you would want to do is to build your credit history, or get a good credit score. And you can do that by getting a credit card, right? So getting a credit card doesn't mean that you spend what you don't have. So you use it, you pay, you use it, you pay. And then with time, you build a strong credit history, because in the US, everything is credit history. If you want to purchase a car, they'll look at your credit history. If you want to purchase a house someday, they look at your credit history. So this is other important things that you should be thinking of. And then if you can, you should get a driver's license. because it also will come very handy. And then social security number is also very important. For example, so most people, once you start your research assistantship positions, you can use your offer letter to go and get a social security card. And once you have a social security card, a different door opens for you. You can do a whole lot of things. And the next thing I would like to talk about is investment, right? Most times they don't tell you that as international students you can actually invest, and I got to know this very late, but it's very important for you to also consider investing your money. It's good to have a savings account, but at times you realize that what you're getting in your savings account is not worth keeping your money there. So there are various options that you can invest. You can invest through your bank. If you have Chase Bank, you can invest through their platform. If you have Bank of America, they have an investment option. If you have an account with TD Bank, they also have a platform that you can invest in. So this is some of the issues that I would also want to bring to your attention. And as I said, you'd have to get to know people, and this is some of the things you can do. You can organize something for perhaps all the African students, but by the way, this was before COVID, so I mean this time around it's going to be difficult to organize something like this. But if you're all vaccinated and you can all manage it, it doesn't hurt organizing something where each African country will bring their main dish for display, and then you can get to know yourselves. You can get to know yourself very well. So I think I would have to end it here. But one last thing I would like to say is that public health is collaborative, right? It's not a competition. Your grade will not affect anybody's grade. The whole class can get an A. Your whole class can get an A B, right? It's not a competition. So always remember that, collaboration is key, and don't, hesitate to reach out to friends or alumni or, faculty members, especially your own colleagues. If you don't understand something, ask somebody, right? There's no harm in asking people to explain things to you, because as you may have realized in Hopkins, most of the time, even exams time, they can tell you it's open book, right? The idea is that they want you to really understand the concepts. They don't really fancy the exam, but it's just a way to make sure that you're learning the material. But getting to know what you're learning and understanding whatever you're learning is very key. And forming small groups, it's also very helpful. If the course, request or the course demands that you can discuss issues with other students, questions with other students, then go ahead and discuss with people. The more you are discussing with other people, the more you're understanding the course. And as I said, remember to always have fun, because it can become very, very stressful. Thank you very much. You know where to find me. You can email me, you can send me a message on LinkedIn, I'll respond. So I think I'll leave the rest of the time for any questions that I have not been able to answer in this presentation. You can use the raise your hand button, and then we'll see how we can go about this.
Awesome. Thanks for the presentation. I thought it was very informative to think about what we're supposed to do this year. So I don't know if anyone has questions that you'd like to ask the speaker.
Okay, so I
Okay.
see. Mommy, is it mommy?
Yeah, it's mom.
Mom. Okay, all right, sorry.
Yeah. Hello,
Okay,
Dr. Banda. Thank you for your time in a Saturday evening to just talk to us. Like, we really appreciate that. Yeah. So I have a question about time management. How did you manage your time during the MPH program? Like, were you working full time? Like, how was the workload for you, and how did you manage it to really succeed?
yeah, so I said time management is very crucial, right? So, for example, for somebody who was doing MPH and MBA, doing a PBA start, doing a certificate, doing two jobs, um, it's it's all about prioritizing your time, right? You know what you're supposed to do. You make a note of all your deadlines. So keeping notes of all the deadlines in your calendar is very important, right? For you to know which assignments are due in what particular day. It's also very crucial for you to use all the communication channels that you would have, right? Because there are times that you can't meet a particular deadline. And if you reach out to a faculty, let them know that for some reason you can't, you can't make up the deadline. They will understand. There have been instances where people send emails on the eve of the exam and tell the faculty that they are not feeling well, they're having challenges, and they postpone it for them. So you just have to communicate and also make sure that you don't overburden yourself. You have to know your strength, right? So you have to know that I can do 18 credits and I can do 20 hours of research assistant position, right? So for international students, if you are in school, you can't do more than 20 hours of research assistantship position. You can't do more than 20 hours. But if it's, if it's a if it's a vacation or a break, you can do like 40 hours. But if you're in school actively learning, you can't do more than 20 or I think more than 19 hours. So it's doable because as you may realize, if you plan your time ahead, you can do a lot of, you have time for your courses, you have time for, networking, and you have time to do, some work. And I'll encourage everybody to at least get a research assistantship position. It's not, even if it's not for the money, it's for the experience, right? It's to have that in your, is to have that in your CV that you didn't just come to learn, you came to also, help with research and all that.
Thank you.
Okay, so I see Wonko. Sorry if I mispronounced your name.
Hello, thank you. It's Chinaza, that's fine. Thank you so much for taking time out to talk to us. My question is, you said something that if we're doing certificate courses, we should take the ones that would give us added skills during the MPH program. I was wondering if you could at least name one or two that you think would be advisable to take or that would give us those necessary skills as opposed to maybe taking courses in others that just we can get over the web or something.
Yeah. So I mean the bottom line is that it always depends on your interest, right? If your interest is not in research, then you don't have to take courses that demand you to do a lot of courses and research. But I would say that for me, the certificates that I think add some extra skill to your portfolio is, for example, say clinical trials or pharmacotherapy and drug safety or health economics, right? These are, some of the certificates that I think, for example, so more importantly, if you're doing, say, epi-biostat concentration, which I think most of you will be doing, then you should consider probably adding clinical trials to it, or adding pharmacoepidemiology and drug safety to it, or maybe getting something in health economics, because in doing epi-biostat, you may not be exposed to a lot of management courses. So if you can get a certificate in health economics, that is also equally important. So for me, if you're doing epi-biostat, clinical trials, vaccine policy, vaccine science and policy, and then pharmacoepidemiology and drug safety. These are the three areas that I think that you can, you're better off, sacrificing your time, because I know a couple of people, when I came in, the alumni I spoke with, those were the regrets that they had opportunity to do these certificates and they didn't do them, right? So if you think you can, looking at the course load, then you should consider these ones.
All right, thank you so much.
Sure, you're welcome. So I see Asifa.
I think Tarafa is next, and then Yvette, and then Redat.
All right. Thank you very much. So my question is concerning the DRPH or the PhD program. When do you advise is the perfect time to apply? Do we apply now, or do we wait till we are done before we apply? What's your take on that?
Okay, so Tafa.
Yeah.
So I've seen your email. I'll respond to it. Okay.
All right.
Yeah. So for if your intention is a doctoral program, I would say, depending on your profile or depending on your background, right? It doesn't hurt to put in an application this year, even though you haven't finished the program. It doesn't hurt, but the probability of you getting into top programs may be very low, especially if, for example, you don't have, an outstanding GRE score, you don't have an outstanding research profile or publication profile. It can be a little bit challenging. And remember that by the time that the application cycle is ending this year, you may not have finished all your course requirements, right? So it becomes difficult for the admission office to really assess your performance during the MPH program. So if you want, you can apply this year, but definitely the best time, if you ask me, is after you've graduated. So the cycle that opens up after you've graduated is the best time to apply. At that time, you might have started your OPT, you might have at least published some papers if you don't have any paper published yet. And then that you could have also built some rapport with the faculty, get some good references from the faculties that you've worked with. That will go a long way to improve your chances, because, for a doctoral degree, most of the time it's your statement, your recommendations, and at times your GPA. So if you can get good recommendation from faculties that you've spoken with or that you've worked with, that will go a long way. You can only do that, as a program on phones, right? So I would say that immediately, like after your graduation, will be the best place or the best time.
All right, thank you very much.
Sure.
Eva?
Thank you very much, Dr. Vanda, for the presentation. So I have a question. So I noticed you mentioned taking courses for either letter grade or pass or fail. So I wanted to ask, is there any disadvantage to taking a course you're not interested in concentrating in as pass or fail? And if there aren't any disadvantages, like what stops someone from taking like all other courses outside their concentration or outside the core courses as pass or fail? Since that seems to be easier.
Yes. So I mean, nothing stops you if the course is not a requirement. If it's not a core requirement, right? And if it's not a requirement for your concentration, you can take it as part. So by way of principle, you can pick all electives as pass fail, and nobody will worry you about it. And as I said, you are